panel, who is a breast surgeon, Dr. Sonia Chandnani, who is an obstetrician and a gynecologist, and Dr. Balvin Ghai, who is an obstetrician, gynecologist, and an infertility specialist. So we're going to discuss on an amazing topic, which is about breast cancer. Not much spoken about, but today we're going to discuss about the risk factors that contribute to breast cancer. I welcome you all, and I would love to hear some, a short introduction and what you specialize on, what is your interest, and why did you choose this topic today? Starting with Dr. Aditi.
नमस्ते, मैं डॉक्टर अदिति अग्रवाल हूँ. मैं ब्रेस्ट सर्जन हूँ. मेरी स्पेशलिटी है कि मैं ब्रेस्ट कैंसर्स भी ब्रेस्ट बचा के करती हूँ. अभी एक नया ब्रांच अपकमिंग है, ब्रेस्ट ऑन्कोप्लास्टी, दैट इज़ माय स्पेशलिटी. उसमें हम ब्रेस्ट बचा के कैंसर सर्जरी करते हैं. मतलब कैंसर निकालने के बाद हम ब्रेस्ट को इस तरीके से रिकन्स्ट्रक्ट करते हैं कि आपकी ब्रेस्ट की ब्यूटी वैसी ही रहती है. मेरा क्लिनिक मलाड में है. बिसाइड्स दैट मैं फ्रीलांसिंग करती हूँ मुंबई के अंदर. सो आई ऑपरेट एट मल्टीपल हॉस्पिटल्स, वोकार्ड हॉस्पिटल, अपेक्स, नमर चिल्ड्रंस हॉस्पिटल, Cloud9, and many more. I would like to thank BabyChakra for giving us this my knowledge with everyone around.
Thank you, Dr. Aditi. Over to you, Dr. Sonia. Dr. Sonia.
Hi, dear friends. This is Breast Awareness Month going on in October. So we all know that we are one of the largest populations in the world and also one of the largest populations amongst the cancer patients. So thanks, BabyChakra, for making our citizens more and more aware about this breast session. And being a gynecologist, I have a vision that no women should undergo mastectomy, because that's the innate part of her body and beauty, and of course a resource for the next upcoming human generation. So if we want to preserve breast, we need to know how can we prevent illness, and more so in case of cancer.
Thank you, Dr. Sonia.
I'm from Surat. I'm at Bombay Multi-Speciality Hospital. I have 2 centers in the city, and I'm visiting various places all over India. Mission Pink Health Chairperson for Gujarat from IMA, and we have done a lot of research for cancer patients as well. So you can connect to us for all your health needs. I'm Dr. Sonia Chandnani from Bombay Speciality Hospital, Surat.
Thank you, Doctor. Over to you, Dr. Balvin.
Good morning, all of you. Namaste. I'll begin with wishing you all a very happy Karwa Chauth, because today we are celebrating that. And Mohali in Punjab. I practice at Ivy Hospital, as ma'am has mentioned, that I have a special interest in India, and I also run my private clinic in Mohali. This is a very great opportunity given to us by BabyChakra, and I myself feel obliged, because somehow मुझे लगता है कि we gynecologists and obstetricians can guide or create educational support to the women of India, and like wherever we can touch them, how they can prevent, identify, and the disease can be caught beforehand, so that, of course, like Dr. Aditi said, उनका काम है ये to prevent, and like so many other aspects. But somehow we play a first step in how a female can prevent herself from getting it, and if she has some problem, identify it at an earlier stage. So, well, I hope we can really help the listeners as we go along. Thank you.
Thank you, Doctor. It was an amazing round of introductions. So we'll dive into the topic, and we'll start with the questions one by one with each doctor. Starting with you, Dr. Aditi, my first question to you is, what are the common causes of breast cancer and the factors that contribute to the breast cancer?
See, the commonest cause of breast cancer, a lot of people take it to be associated with family history, but only 5 to 10% of breast cancers are familial. So बहुत बार पेशेंट सोचते हैं कि हमारे घर पे नहीं है किसी को, तो हमें हो नहीं सकता है, जो गलत थॉट प्रोसेस है. जो सर्वाइकल कैंसर के फैक्टर्स होते हैं, उस एग्जैक्टली अपोजिट फैक्टर्स, रिस्क फैक्टर्स होते हैं ब्रेस्ट कैंसर के लिए. हमारे देश में बहुत वेस्टर्नाइजेशन आ गया है. आजकल हम शादियां लेट करते हैं, बच्चे लेट प्लान करते हैं, बच्चों को दूध नहीं पिलाते हैं, इन कारणों से ब्रेस्ट कैंसर बढ़ता है। हम सब जंक फूड खाते हैं। ओबेसिटी इज़ एन इम्पॉर्टेंट कॉज। अब महिलाएं भी बहुत स्मोकिंग, अल्कोहल में इन्वॉल्व हो गए हैं, तो ये सब ब्रेस्ट कैंसर के रिस्क फैक्टर्स हैं। लाइफस्टाइल, एक्सरसाइज हम नहीं करते हैं। एक्सरसाइज वुड हेल्प अस प्रिवेंट maintaining a good healthy weight would prevent us from developing breast cancer.
Okay. Thank you so much, Dr. Aditi. In continuity to that, Dr. Sonia, my next question is to you. I want to know, are there any few chemicals in the products or some harmful chemical in the everyday things that we use which contribute to the factors of breast cancer?
Yes, a very good question on breast awareness seminar today. The lifestyle which we are living, I think we are using more of plastics, more of preservatives, more of products which are on shelf for a longer while. We have reduced the usage of fresh things. Similarly, the pollutants in the air, especially in the industrial women and working women like us also in radiology department, we are exposed to a lot of radiation which is very harmful. Women in chemical industry, I'm from the city of Surat, so we know a lot of chemicals are being used at our Hajira belt, and especially the exposure to the skin and unknowingly the intake of products which are from dairy, but then we are not sure of the quality. So all these things and our day-to-day vegetables, the water we are taking, sometimes it is not a potable water, and especially in the plastics, all these things in small contents, and especially if not used fresh, I mean refrigerated for a very long time and with a very long shelf life, can lead to breast cancer, uh, mutations, because the cells which are rejuvenated regularly will have the harmful chemical load inside, and when oncogenes are present in all our cells, they'll be potentiated to make cancers.
Thank you, Dr. Sonia. In continuity to that, Dr. Balvin, we want to know more about how lifestyle is contributing to the risk of breast cancer.
Well, this is really important because, like Dr. Aditi said, that हम सोचते हैं कि नहीं इसमें family history का role है या नहीं है, and we end the discussion there. So it's really not that, if you broadly divide the risk factors, आप divide कर सकते हो those factors which can be changed by you and those factors which cannot be changed by you. So genetic factors are those which cannot be changed by you. You can be treated for them. But risk factors which can be changed by you is basically your lifestyle. Now, what exactly do we discuss in lifestyle? It's your diet. When you talk about diet, nowadays junk food, it has a lot of calories, processed carbohydrates, so it has a contribution. So your diet must include something more of antioxidants. So you need fresh vegetables, fresh fruits. You need more of protein. Now, when we talk of protein, we are a little confused here. There's a good protein and a bad protein. Vegetarians are usually always in the good protein, but when you talk of vegetarian protein, red meat is usually a higher risk for most of the malignancies, be it breast, colon. So you must be more concentrated on fish for that matter. And of course, you can have the other kinds, but red meat is definitely more towards carcinogenic. Also, you have lifestyle includes your exercise. You can have at least 30 minutes of exercise 4 to 5 days in a week. Your alcohol consumption, smoking, it has become a part of your life. हमें लगता है ये normal है. Really normal तो नहीं है because हर चीज का side effect है जो हम aware हैं but ignore करते हैं. So if we just keep a check on these things, that will definitely reduce your lifestyle associated risk of any cancer, not just breast cancer.
Okay, thank you. That was quite an insight. Coming back to you, Dr. Aditi, we want to know what are the early signs of breast cancer that a woman should be vigilant about?
We recommend that all women, all girls in fact, after the age of 18 years should start doing something known as self breast examination. जब वो खुद के स्तन की जांच करेंगे तो उन्हें क्या देखना है, that is what we teach usually. स्तन में कहीं पे कोई गांठ है क्या, लंप, ये गांठ में दर्द हो भी सकता है और नहीं भी हो. इसके अलावा ब्रेस्ट से निपल डिस्चार्ज है क्या. यूजुअली जब हम ब्रेस्ट फीड नहीं कर रहे हैं या प्रेग्नेंट नहीं है, हमें निपल डिस्चार्ज नहीं आना चाहिए। अगर ये काफ़ी बार ना औरतों को जब हम चेक करने को कहते हैं वो जानबूझ के बहुत प्रेस करती है, तो कभी कभी ट्रॉमा के कारण भी निपल डिस्चार्ज होता है। तो हमारा रिकमेंडेशन रहता है जब भी आप अपना अंडरगारमेंट निकालते हैं, चेक कीजिए कि उसके ऊपर कहीं पे कोई स्टेन्स है क्या, जिसको हम कहते हैं स्पॉन्टेनियस निपल डिस्चार्ज है क्या। अगर वो ब्लड स्टेन्ड है या लाल रंग का है तो उन्हें तुरंत नज़दीकी डॉक्टर से मिलना चाहिए, अपने ब्रेस्ट स्पेशलिस्ट या अपने गायनेकोलॉजिस्ट से एक बार जाके मिलना चाहिए और कंफर्म करना चाहिए कि ये कुछ वरीसम है या नहीं है। काफ़ी बार ब्रेस्ट में साइज़ में चेंज होता है। अगर हमारा वेट लॉस या वेट गेन नहीं हुआ है, हम ब्रेस्ट की साइज़ में चेंज एक्सपेक्ट नहीं करते हैं। अगर ब्रेस्ट में गांठ होती है तो काफ़ी बार ब्रेस्ट अंदर खींच जाती है। कभी कभी ब्रेस्ट की गांठ का लोकेशन कुछ इस प्रकार का होता है कि ब्रेस्ट साइज दूसरे ब्रेस्ट से बड़ी लगने लगती है। तो अगर आप ब्रेस्ट में कोई लंप नोटिस करते, पेनफुल या पेनलेस, अगर आपको निपल से किसी प्रकार का डिस्चार्ज है, अगर आप ब्रेस्ट में साइज एंड शेप में चेंज नोटिस करते हैं, तो these are alarming signs for which you should consult your breast specialist or a gynecologist.
Okay. Thank you, Dr. Aditi. So, Dr. Sonia, coming back to you, we want to know what precautions should one take from the start so that they can lower the risk of breast cancer or even prevent it?
I think first of all, we should all believe that cancer can happen to anybody, especially Indian women being in Asia, we are at a higher risk. Secondly, the females who have had a history of any endothelial lining cancer, example thyroid, colon, liver, breast in their family, like blood relation में, pedigree में, so they should be more aware. And जिस भी एज पे ब्रेस्ट कैंसर उनके रिलेटिव को हुआ है, उससे एटलीस्ट 10 years before that only, they should definitely visit their doctor around 6 months and plan mammographies and screening tests at an earlier age. And just not give away कि कैंसर हो गया तो nothing can be done. It's a very good survival if you diagnose it early. तो प्रिवेंशन के लिए अवेयरनेस जरूरी है. डेफिनेटली ऑल ऑफ अस हैव शेयर्ड कि healthy lifestyle is very very important, and we have BRCA1 and BRCA2 test in some families where we can go ahead with these tests. It's a simple blood test and the reports are available within a week's time in most of the cities. It's really recommended by doctors, but then I think the platforms like BabyChakra need more and more women to be aware about. Secondly, जब थायराइड के लिए रेडिएशन लेने जाते हैं कुछ बार पेशेंट्स नोड्यूल्स के लिए, तो उसमें ब्रेस्ट प्रोटेक्शन इज इम्पोर्टेंट. अननोइंगली अगर वहां के लिए आप ट्रीटमेंट ले रहे हो और ब्रेस्ट का भी एक्सपोजर होता है, इट कैन बी अ हायर रिस्क फॉर ब्रेस्ट कैंसर. So these are few important things I wanted you all to notice, and more and more women should share this with their family members. जो भी हम जानते हैं, अगर हम अपने आसपास उतना अवेयरनेस दे सकते हैं, it is going to help definitely.
Thank you, Dr. Sonia. So awareness is the important key to, prevent and lower your risk also with healthy lifestyle, of course. So coming back to you, Dr. Balvin, my question to you is, what are like the extra care that a person should take when suffering from breast cancer, like regular checkups, lifestyle changes? What do you recommend?
Well, many a times we've seen that, at some stage the person is detected, they are treated, and they somehow forget that this can happen to them again. So, like you mentioned, yes, regular checkup is important with your treating doctor. Whether they ask you initially for a 6-month checkup, yearly checkup, you must go back. And also, if there is a sudden change, appearance as in, अगर आपका weight तुरंत से गिरने लगा है, आप बहुत कमजोर रहे हो, these are the most common things which females somehow tend to be happy कि चलो हम तो पतले हो गए, but they don't realize that this is one of the earliest signs of a cancer appearing or reappearing. चीज का आपने ध्यान रखना है. And definitely जो lifestyle modification हमने discussed on way of life, it's not that एक बार का चीज हो गई, it cannot happen again. And you are at a higher risk कि आपको दोबारा से वो कैंसर हो सकता है या कोई और कैंसर। सो आपको बिल्कुल अपने लाइफस्टाइल को मॉडिफिकेशन में रखना है। You must go for regular checkups. Any sign, dangerous signs like we discussed, your weight loss or in the breast, any kind of जैसे ब्रेस्ट कैंसर डिजीज हो सकती है अगर कई बार लेट हो जाए, although it has a very good survival, but you must be body में आप abnormal notice करते हो or you're not able to understand, you must go to your doctor again. I think that will be very important.
Thank you, Dr. Balvin. It was a very informative session from all the three panelists that we have today. So now we'll dive into user questions. Our viewers have shared a few queries that they want you experts to answer for. So this is an open question to all the three. All the three panelists can give their views. So starting with the first question, one of the users, she's asking, I have a family history of breast cancer. How can I lower the risk of suffering from the same?
I think we already answered this, that depending on the pedigree analysis, in case BRCA should be advised, the doctor who has treated the family member can guide. Self-breast examination starting from a very early age when the breasts are developing, we should make our young girls aware about it. And she herself can visit a doctor frequently, get a clinical breast examination done. And breast is not only the part which is elevated here, it's like the axilla and the cervical region as well. So taking care of this part beautifully, having a beautiful healthy lifestyle. And in case it is appearing in her body also, early diagnosis is the key to live a good life.
Thank you, Doctor. Dr. Aditi, your views on the same?
As I said earlier, and as Madam also said, that self-breast examination is our key. When you have a family history, we recommend that 10 years prior to the index patient who had breast cancer, we ask relatives to become aware and start getting themselves examined. After the age of 30 years, we recommend that they should meet a doctor who specializes in breast and get themselves examined once a year. And after the age of 40 in India, we recommend every year they should get an X-ray mammogram done to be sure whether they have any new lump development or any microcalcifications. If any patient with a family history follows this, it would be easier for us to pick up cancers earlier. And as I said, it's only 5 to 10% who would develop it. So 90 to 95% won't develop it.
Thank you, Dr. Aditi. Dr. Balvin, your thoughts on the same?
Like what the other two panelists have said, that yes, if you are aware that you are at a risk, please get yourself the same. आपके पास blood tests हैं, and also अगर आपको breast cancer की history है, you risk of having ovarian cancer, of uterine cancer. So basically, you have to live a healthy lifestyle, and at the slightest suspicion, you must get yourself treated. It's important thing that you're aware of it, so please work towards it in that direction, that you can detect anything.
Thank you, doctors. So the next question is, one of the users is asking, I'm experiencing a hard lump at times in the breast that subsides in a few days. Is it a sign of a breast cancer, or should I be worried about the same?
Most of the lumps are benign. The first thing I would recommend is meet a doctor. If it is disappearing, most likely it is hormonal change. But then still a basic sonography is mandatory. But age and the family history and other risk factors, we may advise a mammography or a FNAC, that is biopsy also. And in case it is suggestive of some disease, excision of a breast, very simple surgery, and cosmetically also we are taking wonderful care. So just don't sit on it. Get yourself examined, diagnosed well, and remove it.
Any other two panelists want to add a few points from their side?
For any breast lump,
I want to say something.
Man, go ahead, man.
Dr. Aditi?
No, please continue. It's okay.
For any breast lump, we would recommend now the latest guidelines is to do something known as FNA-B biopsy, and the biopsy would help us to know whether it is a non-cancerous lump or it is a cancerous lump. If it's a non-cancerous lump less than 3 centimeters, lot of times we just keep these patients on a follow-up. We just keep observing them maybe yearly or 6 monthly to see if there is any increase in size or any change. And for patients who have cancer, definitely once we have the biopsy report, we can plan up a definitive surgery.
Okay. Dr. Balvin, you were adding a few points.
Yeah, like you mentioned that she feels a lump which disappears sometimes. I think that, sometimes it's just out of fear that we misinterpret our symptoms. So many times, female, the consistency of breast before and after their periods. This is because of the hormonal changes in your body. But yes, if it is a definitive lump, you must definitely check for it, and that is the way to go about it.
Okay. Thank you, doctors. I guess we're done with all the questions and the queries that our users had and plus that came up on the app. So it was a wonderful session. The 3 panelists were just amazing. I'm sure the information that you guys have shared will add on a lot of awareness to all our viewers. For any more queries, our users and viewers can get to BabyChakra platform and also contact the doctors directly as they've shared their details. Thank you, all the 3 doctors, for such an amazing session, and we look forward for one more coming up next month again. Thank you so much.
Thank you so much, everybody. Seema,
Thank
you
you,
were
ma'am.
amazing.
Thank you, doctor.
Thank you very much.
Thank you.
Thank you so much, BabyChakra. It was a wonderful, and thank you, Seema ma'am. You're an excellent host. Thank you.
Thank you,
so
Dr. Seema. Thank you, Dr. Sonia. And thank you, Dr. Balvin. Thank you very much. It was nice interacting with all of you.
Thank you, everyone. A good day to you.